Well, hey, it's Sean P. Neal, the host here at Fringe, and I am so excited to bring you this episode of Lead the People. Now, Lead the People provides you with a roadmap to realizing your full potential as an authentic people leader. And in each episode, Dr. Matt Poepsel, aka the godfather of talent optimization, well, he and his guests are going to explore a wide range of leadership topics and trends. And it's going to be really informative, and I promise you it will be engaging. So I don't want to hold you back any longer. Make sure you get everything you can out of this episode. It'll be packed full of great stuff. Let's get into it.
It's time to lead the people. The show for aspiring leaders at every level. If you want to boost your self-confidence, get noticed, and maximize your impact by leading others, you're in the right place. I'm your host, Matt Poepsel. Ready to lead? Follow me. My very special guest today has 34 years of experience in the neonatal intensive care unit. She practiced as part of the faculty of 2 medical schools and in private practice. She authored over 30 peer-reviewed academic papers, and we'll be chatting about a book that she wrote later today. She and her physician husband raised 3 children who are all now young adults, while both of them practice medicine full-time. She is Dr. Susan Landers. Welcome to the show, Susan.
Thank you, Matt. It's a pleasure to be here and chat with you today.
Now, when I saw your background, I have to tell you, if I had to think of one of the most stressful things that a person can go through, having a child in or working in the neonatal intensive care unit would have to be right at the top of the list for me. So what is it that drew you to that type of work?
But you're right. Having a child in the NICU is very traumatic for young parents. Working in the NICU is much better because you're armed with all the therapies and ventilators and tools that you need to take care of these tiny babies and sick newborns. I finished college 6 months before med school and got a great job working as a scrub tech in an OR in the General Hospital of my hometown in South Carolina. I fell in love with surgery. I went on to medical school. I did very well. I wanted to be a surgeon. I was dating a guy who also wanted to be a surgeon, and he said, I don't want a surgeon for a wife. So I changed my specialty to pediatrics, thinking I would go pediatric surgery. I liked pediatrics too. And I decided to leave the South, went to Dallas for residency in pediatrics, and fell in love with neonatology. It is a critical care specialty that's all about mothers and babies. The PICU, the pediatric ICU, also was very alluring to me, but those kids seemed more like they were solid citizens who were sick. And I enjoyed working with the babies and the moms and dads because they were sort of imagining what their children could be. And it was an emotionally raw time, especially for parents who had an unexpectedly preterm or sick baby. And that drew me to that field. I liked the intensive care parts of it too, but I really enjoyed visiting with parents and supporting them and helping them deal with the roller coaster of emotions that they go through in the NICU.
And I don't have any exposure to medicine at all, but when I think about stressful environments like in an emergency room, or I think about the NICU, is it the emotion tied up in that situation, or is it the pace? Can things change quickly in the condition of the baby, or all the above?
All of the above. The pace can change. The delivery might be emergent. The baby might be on death's door 1 minute and an hour or two later after artificial surfactant and the right ventilator settings, they're improving. Or they may be about to die of overwhelming sepsis, a bloodstream infection, and with the right antibiotic and steroids, they turn around. So it's this, it's a place where there's lots of heartbreak that usually gets healed, and most of the babies recover and grow and thrive and go home. for some people, a smaller percent of the tiniest preemies and the sickest babies, the heartbreak doesn't mend and they lose their child. And you know, that part of it kind of called to me too. I thought it was not pleasant, but it was fulfilling to be with people who, especially parents who had this idea of having a baby and what their child was going to be like, to be with them in the last moments. That wasn't easy at first. You have to sort of grow into it. It's not easy to sit with people when they lose a child, but I I actually thought that that personal touch, the way that I could get to know parents while they had a child in the NICU, was something that I really enjoyed quite a bit.
It's almost like the exact opposite of what we hear sometimes of surgeons who talk about the appendix down the hall and almost dehumanize the process for whatever
Right,
reason. I wouldn't really
right.
understand that, but you're talking about bringing a very human approach to the most human experience so someone could have.
Yes, yeah, and you know, moms handled it different ways, and so did dads, and it always created fear and disappointment. And as the child got better, it was much easier to get to know the parents because they would let their guard down. Now, sometimes it was too busy to visit much with parents. Other times, I mean, some of those little kids stayed 4, 5, 6 months. The
Wow.
tiniest little preemies will stay a long time in the NICU. And you really do get to see the parents in all of their glory, all of their challenges, what's going on with the other kids at home, how far are they having to drive, who's paying for what, how
Hmm.
the battles with insurance. So I liked the blend of surgical and medical. I liked getting to know the families. I loved working on a team. The NICU is just the epitome of teamwork. You've got the neonatologist, you've got the bedside nurses. Usually they would have one or two patients. I mean, critical care, you really can't have three or four, or you miss things. Then there was a respiratory therapist. Then there were the nursing assistants, and then there was the unit clerk. And then there was the pharmacist and the social worker and the chaplain and the lactation consultant. And it took all of those people to take care of the sickest babies, just like it takes a bunch of people like that to take care of sick COVID patients in the ICU.
Mhm.
And the public doesn't realize that it's not just the doctors and the nurses, it's all the support staff. And I loved the way when a baby was really, really sick, everybody jumped in, very few words were spoken, and we all did our jobs well, and hopefully at the end we were rewarded. So I like that. I miss the teamwork the most. I miss that.
Yeah, and it seems like it's a pretty obvious and easy cause to rally around. You've got this tiny baby that needs the attention and the specialization and the support of such a diverse crew working together. I'm sure there were obviously differences in times and pressure and stress, but I love that. I love that example. And I wonder if we can go back to something that we were talking about, how moms and dads might handle things a little bit differently. And it occurs to me that people handle stress, both acute stress and chronic stress, differently. And it's true whether we're talking about the medical staff or whether we're talking about the patients. But what are some of the things that you observed in your time that kind of helped explain why some people had one approach to this sometimes a very stressful situation, emotional roller coaster, you
Right.
described it? What were some of the things that led to differences from what you saw?
Obviously, the personality of the parent and their expectations predicted how well they were going to tolerate disappointment or illness in their baby. Sometimes the most rigid thinking people, sometimes ultra religious, evangelical, were the ones that could not accept anything but
Hmm.
the miracle working. They had a hard time accepting the reality of a bad outcome. Most people were so fearful that they hung back psychologically until they either understood what was going on or felt more comfortable and could ask questions. Most people got quiet and introspective. The mothers felt guilty. The saddest thing about NICU is that most of the preemie babies that are born are no fault of the mother. There's no cause of the preterm delivery. But the moms think, I must have done something wrong. So you're dealing with a parent that's already guilty. They're terrified. Oh my God, I'm not taking home this beautiful full term baby. Dads tended to be more reserved than moms, show less emotion. I think you guys are raised not to show your feelings as much as us women do. They were great about asking questions and writing things down and taking instruction. The mothers really needed to be allowed to touch and talk to and sing to. And that was the thing that would always take them from fear or grief or terror to being a mom. When we could get the baby in their arms, when we could get their hand in on the baby, when they could feel that attachment literally to their child, because most of these women had the baby taken from them at delivery up to the NICU. And so when mom could finally be a mom to that baby, they always would settle down, they always would relax a little. I'm generalizing, but you get the drift of it was the medical situation, it was the gender of the parent, and it was the baggage that each person comes into the NICU with an expectation, well, all this treatment is going to work and my baby's going to be fine. Or, oh my God, can you really take care of this? I mean,
Yeah.
if my child has a brain injury, really, what's going to happen? How's it going to show up when he's 2, 3, 5 years old? So the educational level of the parent made a big difference in how they responded. Religious background made a huge difference.
Yeah, in corporate world, obviously you don't deal with the same humanity and the same medical situations, but I would draw a parallel that trying to understand your team members' needs and understanding how to meet those needs however you can allows you to make a connection. If you can't meet their basic needs, then it's hard to get them to open up or to advance to the next level of a progression, whether you're trying to help them develop or embrace a new strategy. And again, it almost feels odd drawing these parallels, but during the pandemic, when we started to change business models and we had people who we had to let go or people who ended up leaving, and they're leaving in droves now through this great resignation we're going through, it's causing a lot of change that people didn't ask for. So it's not the same as having a child in the NICU, obviously, but I think there are some similarities that once you find a way to make a connection, if you can get some of their basic needs met and get them to that next level where they can actually process, then the forward momentum can begin at that point.
I agree. And we would occasionally have a team meeting because a particular nurse or a particular respiratory therapist didn't like the plan or didn't like what they were hearing from the parents or didn't like what the doc was saying. We would gather everybody around and we would say, okay, here's what's going on with the kid. Here's the real data. What's everybody think? And somebody would say, well, why can't we do so and so? And questions would be answered, but the team members had feelings about what was going on and how the parents were reacting. The team members all got to know the parents too. And it was if the NICU team and the parents were a team and the baby was the product.
Mm-hmm.
And so in that way, and I loved that aspect of it because I really liked, tell me what you're thinking. They would tell me at the bedside one-on-one, but then when we were in a group of 5 or 6 or with the parents in a conference room, they wouldn't want to speak up. And so it is challenging. It's very, very challenging for a leader to draw out what's going on with the team members and how that person's attitude affects the product or the service that you're delivering.
Yeah, we talk a lot about creating safety and psychological safety and making it okay and building trust so that team members will speak up. And before the pandemic, a lot of leaders, let's say that you're reasonably good at doing that. Well, now all of a sudden you have a very different person who's returning to work. They just put their kids on Zoom school. Maybe somebody in their family is sick and they don't know what's going to happen. And they're still trying to work. And you're like, boy, the techniques I used to use aren't working in this situation. Well, that's because the person's different. Like there's things
Right.
going on for them. And that's something that you know something or two about as well. You talked about having
Yeah.
a busy life. Obviously, you were taking on work from all sides, both at home, but you mentioned raising children as well, and two doctors in the as head of household, so to speak. So, what can you tell us a little bit about those circumstances and the experiences that you had that led you to write your book, So Many Babies? I love the name of that book, So Many Babies.
Thank you. I have to confess, I was a workaholic. I'm pretty typical of the baby boomer generation. I was my job, and I became a neonatologist before I got married and had a family. And so the first 10 years of being a mother, I had to learn how to be a good enough mother and leave my work at work and not bring all the stresses of the NICU home with me. Having a pediatrician husband was golden. I mean, he was a great helper. When I was on call in the hospital at night, he did everything I normally did. And we were a really, really good team. Two full-time jobs in medicine are not compatible with having a normal family life. We didn't have a normal family life. We had nannies, we had teenage chauffeurs when the kids were a little bit older. We would trade call. I would be on one weekend, he would be on the next. We tried all different combinations of schedules. And so for parents today who are both professionals, both working full time, I want to just say it is not easy. If you and your spouse are juggling childcare, work, maybe sick parents, not to mention a pandemic, the communication has to be clear. The support systems have to be there. There has to be a way for the couple to maintain their relationship because the family dies if the couple doesn't stay together. My husband and I went through many ups and downs over the years. We've been married 38 years, and there was one time that I had a job that I disliked so much, I almost left. And he loved his job so much. And we had to struggle to work on our marriage and to make a decision. And we actually decided that's when we decided to leave academic medicine and move to Austin, Texas in private practice. So professional couples that are both working have two sets of identities, two sets of goals, and then one's a mom and one's a dad, and they do that different ways. And they both are carrying a lot of other issues around with them. So my book reflects how all those things came together, how I learned to be a good neonatologist, how I learned to be a good enough mother. I helped my all physician, all man group in Austin learn how to do things that were family friendly. I said, we don't need to start at 7 in the morning. Let's start at 8. I can't put my kids on the bus and be here by 7. And they would look at me like, what? They all had stay-at-home mom wives. And then I said, well, my husband and I need vacations. We kind of need to schedule them in advance because we both have schedules. And they went, what? And so there were lots of issues, and then there was the class play. Can somebody cover 3 hours because Laura's got a class play? And they went, okay. And over the years, the whole practice became family friendly. I mean, not all the time, but because men and women have different priorities. But most of the time, they learn to accommodate wives and mothers because we're different. We just think about things differently. We carry our children's problems to work with us. I was very guilty of that forever and ever. My children, just the other day, somebody was telling me, your husband did exactly the opposite of you. He would go to work and tell stories, funny stories about his kids. And I would go to work and go, oh my God, so-and-so is having such a hard time. And talk to my colleagues, my peers, other mothers. And so our approach to what was going on in our family and how we took it to the workplace was totally different. And I think young couples need to expect that their personalities and their identities are going to affect how they adjust to all of this work and family. It's just no easy feat.
No, and it's getting, it seems to be getting harder and harder each generation. Life gets more expensive. The likelihood of two professionals, having families, the demands, the nature of the erosion of work-life boundaries now in virtually every job category, it's challenging. And I think one of the things that I really picked up on, Susan, that you're talking about is you may have something figured out, but then something may change either in your practice or in your job or in your, kids get to a certain age or a kid now develops a certain challenge with something at school or whatever. All of a sudden it was smooth sailing and now it's not. We're not different. Why does it feel different now? It's like you have to be a little bit more malleable because things are going to change and evolve over the course as the two of you evolve as a couple, but also your situation, your children, everything changes around you.
Right. And people who are working from home are missing the office relationships with coworkers. I miss my coworkers so much. It is so important for professionals, working parents, to have other moms to talk to in the office, other dads to talk to. God, our teenagers driving us crazy. What do you think? And if we're working from home, that's harder to do. You may not even be able to do it at all.
No, you can't schedule a Zoom to talk about your teenage daughter and try to get some advice. Like it doesn't happen the same way as it might happen in a cafeteria when you're both getting a cup of coffee. Hey, how's Sally? Oh, Sally's going through a tough time or whatever.
Right.
Yeah,
exactly. And I really miss that. And I bet the people who are working from home are feeling less of a support system than they used to have.
Yeah. And it's a challenge now because especially for knowledge workers where you have some flexibility that you could work from home or you could work in the office. But if going to the office means an hour-long commute, it really tests your will to do that. And so they're looking for a lot of workers are looking for a lot of flexibility. Maybe I'll go in a couple of days a week instead of 5 days a week so I can balance the load a little. And employers are like, what is this? Like, it's safe now. Come on back. And they're like, yeah, we're not coming back the way we did before. Right. So we're all kind of learning and evolving together. So it's great counsel that you've had for us on sort of how that can change over the course of and how you have to teamwork, communication. I love the themes that you've shared today. But I also have a game for you. I'd love to spring on you. I call this game Oh Baby, and it's a trivia question all about babies. I have a feeling you're going to crush this. I will tell you that I got almost all of these wrong, but let's see. I think you're going to be just fine. So here's the first one. Babies are born without which body part? Is it A, elbows, B, kneecaps, or C, shoulder blades?
Kneecaps.
Kneecaps is correct. Are kneecaps not actually bone? Is that what it is?
Yeah, they're bone, and they haven't ossified yet. Well, just like their teeth. You can't see their teeth, but they're up in there.
They're in there somewhere. They're in there somewhere. Okay. All right. See, there you go. I learned that. Okay. How about this one? What percentage of babies actually arrive on their due date? Is it A, 80 to 90%, B, 30 to 40%, or C, 3 to 4%?
80 to 90%.
Is that right?
Only 10% of kids are born prematurely, unless there's a problem and the obstetrician has delivered early and the dates are bad, things like that. But 90% of babies are born healthy and full term.
Gotcha. And is it on their due date, or you're saying like on or after, like maybe by a day or two?
Well, 39 to 41 weeks. Okay, yeah, perfect. Around 40 weeks gestation. Yes.
Okay. All right. And has that changed at all over the years, or is it like, no, that's kind of been how it's always been?
Yeah, that's a whole nother discussion. When moms started asking for inductions and elective sections, And when OBs started to try to schedule things at a certain time, so grandmom could be in town,
Oh my gosh.
the due date got pushed back. So instead of 39 to 40, we were seeing babies being born at 38, 39, but some of them were preterm. They weren't really 38. And so we've corrected all that now. We've got this hard stop rule of no elective deliveries before 39 weeks. But moms and OBs have been trying to make the due dates the way they want them to be forever.
I have 3 kids. They're all in college now. You'd be shocked at how little I know about kids, even with all that experience. But here's one that I also did not know. How heavy was the heaviest baby ever born? 13-ish pounds, 23-ish pounds, or 33-ish pounds?
I thought there was a 23-pound baby born lately. I read in the news. I have only taken care of one 12 pounds.
12
That's
pounds.
my personal biggest.
Personal record?
Infant of a diabetic mother. What's the answer? Is it 23 pounds?
23-ish pounds. Yeah. And by comparison, a baby blue whale, 5,000 pounds at birth. So
wow.
It's all relative, I guess. How about this one? What percentage of women experience morning sickness? 7%, 17%, or 70%?
Wow. Not positive, but I would guess 70%.
That is correct. And is there anything a woman can do to reduce the likelihood of getting morning sickness, or does that just come with the territory?
It comes with the territory. It's progesterone. It's the effect of progesterone. And I have to tell your listeners that there's a lot of controversy now over young women smoking marijuana to decrease their nausea, and the fact that marijuana is not good for the developing fetal brain and neonatal brain. And we're getting lots of different opinions, and the pediatric and obstetrical societies are trying to get together to have recommendations about the treatment of nausea in pregnant women. So I'm sure some of your listeners who are pregnant have either have smoked weed or know somebody who smoked weed to make the nausea better.
Not advised. I think
not advised.
So here's a trivia question that's not on the list. My mother, so I'm Gen X, so it's going back a little ways, and my mother is very quick to proclaim that with my sister and myself, she says, I smoked and drank through both of you. And I'm like, oh, okay, that's great. Thanks, Mom. It's a different time. We've learned a lot since then, I'd say.
Right.
But I'll get you out of here with this last question, Susan, which is, where can my listeners go to learn more about you?
Oh, my website is susanlandersmd.com.
Awesome. Well, I will include those links in the show notes. Thank you, Susan, so much for being with us today.
Thank you, Matt.
Here are my absolutely adorable top 3 takeaways from today's episode. 1. Leadership can be high stakes. Dr. Lander's experiences in the NICU may be unrelatable for those of us outside of medicine, but our leadership outcomes are incredibly meaningful in their own right. We need to match that intensity. 2. Get personal. People handle stressful situations differently. Get to know your team members well and work hard to meet their needs while helping them perform at their best under the circumstances. 3. Be the home team. Your spouse, partner, or family members may not come to work with you, but your work comes to them. Stay close to one another and co-develop strategies to meet all the demands you face together. If you enjoyed this episode, please consider hitting the subscribe button in your favorite podcast app. Thanks for making this investment in your leadership ability, and thanks for sharing this podcast with another aspiring leader who needs to hear it. All right, leaders, until next time, don't just manage the business when you can lead the people.